Have you ever wondered how to interact with an individual who suddenly starts rocking back and forth in an airplane flight when a child starts crying out loud? Or a parent who is trying to take control of a situation when his or her daughter or son is just flailing or throwing a tantrum in a parking lot because a police car or an ambulance just passed by. These are just a few examples of the sound or noise sensitivity that may be very common for individuals in the autism spectrum disorder. And it is also very common that you're going to interact with somebody on the spectrum in your neighborhood, your community, or your workplace. Many children and adults on the spectrum have a lot of psychological issues like depression, obsessive compulsive disorder, and anxiety disorder when compared to their neurotypical counterparts, as quoted in a recent study in the Autism Journal of Developmental Disorder. However, as a speech-language pathologist, I have experienced while working with adults and children and co-treating with an occupational therapist or a psychologist that we work very hard to create context to learn language and practice social skills. I have worked on one-on-one setting with individuals and also in group setting where we have been able to make goals that are in context for the individuals and makes more meaning for them. Example, running a lunch bunch program for middle school age kids was a lot more rewarding for them and more meaningful. So as individuals and as therapists, we are working very hard to teach these social skills and communication skills to the adults and children. However, I just want to be very mindful and bring the point across that it is very important to work towards improving the quality of life of individuals on the autism spectrum disorder, but still keeping that unique personality and their difference as their own uniqueness. So we should keep that in mind as we develop goals and work with strategies for children and adults on the spectrum. Autism diagnosis can be a life-changing experience for a family. All you have to remember is you're not alone. There are no known cures for autism. And you may have this feeling of why me? What was it that I did wrong? You may even require the support and need of visiting a specialist to deal with it. So you're not alone, and you know that you should take care of yourself. Just like in the airplane, they say, put the mask on yourself before you put it on your child. So take care of yourself before you move on in your journey. We're going to hear from other parents and what was their journey like.